Welcome to Wear Your Cape to Work, a podcast hosted by Project Insight. We think that project and program managers are the real superheroes of every organization. They wear their capes to work every day, and we want to celebrate them. Our guests have poured their superpowers into driving successful projects across every industry. We want you to hear their stories to be inspired to wear your own cape to work. Today's guest is Michelle Dickstein. She's a PMP in the nonprofit space and has been working in pediatric healthcare for most of her career. She also has her master's in public health. Michelle brings some really great superpowers to our podcast today. We'll talk about her ability to be a flexible communicator, manage expectations, and liaise between product teams. She's also had some great experience standing up an enterprise PMO, and she refers to it as having Mary Poppins syndrome, but you'll have to listen to find out why. Thanks for joining us today, Michelle.
Thank you. So happy to be here.
I met Michelle at the PMI Global Summit in Los Angeles in September. I was there with Project Insight, and she was attending. How did you love that event?
I totally geeked out on project. I'm already a project management geek, but talking to other people from other industries and finding community around the same things that we get frustrated about, like it just doesn't happen in my sphere. It happens in academia. It happens in government work. Like to hear that everybody's feeling the same frustrations, it felt really good. And to talk about
That's
like different strategies and tactics, it was so cool.
that's really interesting that you bring up that some of these things, the challenges that project managers face, are the same no matter where you're working. You could be in one
Yeah.
industry or another. It's probably going to be a lot of the same. But some things are different. And
hmm
today we're talking about you and all of your work in the nonprofit space. You've had a lot of experience. Would you say that like 90% of your career journey has been in that nonprofit healthcare space?
Absolutely. For sure. I spent like maybe 2 years in the for-profit world and then went back to graduate school. And I've been in the nonprofit world ever since.
And what is the draw? I mean, do you just love it or you feel like it's just found you or what would you?
I would say it's probably like a bit of a family legacy because my mom was a social worker and always worked in nonprofit world and as a helper profession. And I am very mission driven. So like really inspiring missions, like it gives me the reason to wake up and log onto my computer in the morning.
The mission of the actual organization that you're working
Yes.
for. So you can get
Yeah.
behind your project work based on the mission of those types of
Yes.
organizations. Oh, that's great. What was your first experience in the healthcare space? I think you mentioned pediatric healthcare.
Yeah. I've always worked in pediatric health, like working in healthcare. I've always done peds. I had just graduated with my master's in public health, and I was working in pharmaceuticals on the for-profit side, doing market research, and I switched to the nonprofit healthcare world, and I was like, this aligns with my heart. That's kind of what it comes back to. Like, we're doing it for the kids. Yeah, let's do it for the kids, of course.
I love that so much. This
Mhm.
aligns with my heart. I think now I've never seen a t-shirt and I've never seen, like a mug that does that, but this aligns with my heart is so great. Speaking of
Mhm.
mugs though, I have my mug from PMI Global here. Do you have yours?
You
Oh, you do.
too.
That's
I
awesome.
mean, I look
For
amazing as Superwoman.
You do look amazing as Superwoman. So, for our listeners who
Mhm.
can't see us on the video, Michelle and I both have mugs that say, Wear your cape to work. And if you've been on our podcast a little while now, you've seen that all of our guests have been given one of these mugs with themselves, a rendition of themselves as a superhero project manager, because, of course, Project Insight believes every project manager is a superhero. And besides aligning with your heart, you do wear your cape to work, every day,
Yes.
every project manager. But how would you say in the nonprofit and especially pediatric healthcare space, as a project manager, which isn't a nurse, it's not a doctor, it's not, you
Yeah.
have your master's in public health, but how do you bring that cape, that strength, that um, skill set that is truly yours to
Mhm.
shine? How do you
Yeah.
bring that into your project work?
Oh, it's so easy. It's because the project teams in the healthcare world, it's doctors and administrators and the frontline facing folks who work with the patients. So, like, I'm not the one that's working with the patient, but I'm helping supporting the team that is and helping them reach their goals. So, for example, one of my earliest projects was working to reduce preterm birth.
Okay.
And it was like, working with the maternal fetal medicine doctors and the nurses and social work and identifying the mothers who are at risk for preterm birth. And it's like everybody has the technical expertise in the medical side, but I know how to create the plan and the structure and identify where are the metrics that we're going to measure by, when is the data due, how do we write our reports. Medical folks, they can save a life to the ends of the world, but they would be really intimidated by an Excel spreadsheet, which is like
Oh,
my
yeah.
jam. So
Right?
it's a great partnership because they
Yes.
have all the medical expertise that, like, I know enough to be a little bit dangerous, but I'm not prescribing medicines to extend pregnancy. So
Right.
I show up with, like, okay, you're doing all this great work. How do we organize it? How do we share that? How do we report back to our funders because it was a grant funded project?
Oh, I
All
see.
of the structure around that. And then while I was working on that project, I found out I was pregnant with twins. So I
Oh
was
my
working in the
gosh.
department that I was also a patient. It was
That
wild.
is so incredible.
Yeah.
I've talked to you a few times and I don't think
Hmm.
I knew that
Yeah.
here you were doing this project work at an organization where you ended up, okay, well, you can do me some favors too now. Okay, so I just have to reflect. You're doing a project on preventing early deliveries and
Yes.
you became
The poster
the
child for early
subject,
deliveries.
the poster child.
I
Oh
was
my
I was
goodness.
not, I wasn't the targeted audience because
Ah.
it wasn't because of multiples.
Okay.
We were the project focused on singletons, but it was just kind of wild that I was like, I know too much about preterm birth now, and now I'm at high risk for it. What the
Oh
heck?
my gosh, that's funny. So, okay, you said 2 things. You said multiples, which I presume
Yeah.
is twins, triplets,
Yes.
quadruplets, and
Yeah.
singletons. Is that how you refer
Yes.
to
Singletons
one
are
at a
just
time?
one baby at a time.
So, speaking of twins, we're going to talk a
Yeah.
little bit more about your circumstances with your twins. And we're
Yeah.
going to share in the show notes too a link to your blog. Because for those of you listeners who want to hear a little bit more about Michelle's journey into having twins and also, a little more about her life outside
Mhm.
of project management, we're going to share that there. But let's scoot back to the project that you are on. So, I want to kind of segue back to talking about these expert doctors and nurses and how their skills, needed to be kind of corralled. Like you had to, I think I wrote down that you wrote Excel spreadsheets are my jam. I think
Yeah.
that's
Mhm.
great. So you're taking all of this expert work that otherwise would have gone maybe unreported, um,
Mhm.
gathered, quantified, and you're bringing that to not just a report for someone, to look at in the funding group that you mentioned, the grant group, but
Mhm.
you're helping execute the timeline, the schedule,
Yeah.
the tasks. What did that look like? Was it a lot? I mean,
It
complicated?
was so I walked in I was hired initially for 3 government-funded grants, and this was one of the projects. And
Can we
the
talk about the money? I mean, what were these grants
oh
for? How much
gosh,
money are we looking at?
it was $3 million over 5 years. Yes.
Yeah, this is not small. I mean, for listeners
Mhm.
who aren't project managers, maybe don't always encounter that now you're responsible for executing this project that's bringing in $3 million. That's
And
something to
stay in
really.
budget and
Mhm.
and we have quarterly reports of where we're at with the budget and meet with the teams and talk about where we're at with budget.
Mhm.
Now you're like, the wheels are turning, it's bringing me back.
You can't waste that money. You can't waste
No.
time, and things have to be delivered at the right
Yeah.
moment.
And the government could pull the funding in the
Oh,
middle if they weren't getting the results. Like, we had
I
to
see.
apply for it again each year annually.
Oh my.
So it
So
wasn't just like,
it.
here's all your money all at time. It was we would invoice for what we had spent with, this is the budget we're
I
expecting. So
see.
it was interesting.
I mean, these are really projects that you can get behind and
Yeah.
It's motivating to do them well and to make sure they happen on time and that that funding continues. For the project managers who are listening, this is a challenge that you probably face in your own work. This idea of an on time delivery, on budget, with all of the tasks that were expected and deliverables expected, check, 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 I say in the
Mhm.
show. It's pretty impressive. And it takes a lot of superpowers. What would you say is your number one superpower, as you do project work?
I'm gonna say like blanket statement communication, making sure
Mhm.
everybody is on the same page. And being a project manager, it's like almost a job requirement that you have to be flexible to whatever modes of communication people prefer. So
Mm.
doctors are not on Teams all day long the way I am, doing my remote calls.
Microsoft Teams, yeah.
Thank you.
Mhm.
Um, but they might prefer an email or a phone call or a meeting. So,
Mhm.
trying to get the information disseminated at the same time to all the stakeholders, it was, we had a meeting, I emailed out the information, and then like maybe they needed a phone call to talk about it to make sure they understood. So, communication is my superpower. And then along those lines, being in the room and thinking, um, the most obvious question, but it's probably the hardest question to answer. Like, even for example, I was recently in a meeting where someone said, I may have missed this conversation, but what is my role on this project team? And I had to be honest and said, honestly, I don't know. Let's talk about it.
Oh,
Because
yeah.
it seems so simple and straightforward. What am I doing here, guys?
So your superpower was to ask that hard and obvious question to find
Yeah.
what they were, and not always about someone's role, but whatever that question
Oh, yeah.
was.
It could be. Here's
Mhm.
another great example, doing that preterm birth project. The project is 5 years out, like a 5-year timeline. And the way we are identifying mothers is they had one previous preterm birth. So even if someone had a preterm birth today, we have to identify when they're pregnant again within the next 5 years, guessing that they're going to get pregnant again. So like sitting sitting in the around the table with all these, chairs of departments and folks who are really high up in the hospital and saying, does this timeline make sense? Because we're banking on mothers having another pregnancy within 5 years. Did again, this grant was already written and awarded by the time I got on board, so I had to work with what was
Oh,
stipulated, but
right.
I was like, I don't know if 5 years is enough time for
You know, that's
birth
that's
planning.
another That's another interesting piece that you bring up there, that as a project manager, you may come into a project when some of the things you might have arranged differently are already
Yep.
set. This is how it's
Yes.
going.
Yes, that I think that's true in a lot of project work because you have your sponsor and they come out with, here's what we want to do, here's how much time I think it should take, and here's the budget. And the most time spent for me at the start of a project is kind of canvassing the project team, our resources, to really understand how much time is something going to take. So when they say, it should be 3 months, and then you talk to the people who are the doers, they're like, it's going to be 9 to 12 months. So then circling back with the sponsor and saying, well, here, I know you set out a 3 month timeline, but here's how much time everything is going to take as we lay it out. So managing expectations is a huge piece of this.
Mhm.
Sometimes you can have the conversation and change the scope of the timeline. Um, but sometimes you're just, this is what it is. We have
It's going to be
restrictions.
this way.
Yeah. And you just got to make the best of it.
So I'm hearing, definitely, I agree with you. You said this high level communications, but from a standpoint of being able to communicate in all different channels, so
Hmm.
flexibility of communication.
Yeah.
You also talked about being confident in communication. Listeners, just really think about it. How many times are you in a call, a Zoom meeting, a phone call, a seminar where you're like, I don't understand what is going on here. Does everybody understand what's going on
Hmm.
here except me? So, Michelle's your gal. She's going to be the one that asks this obvious question in the room. I love that. And then communication about managing expectations too, with whether you've started from the beginning of the project or you're just jumping in, this idea of what is everybody expecting to get out of this? And also, what are the project doers expecting
Yeah.
as it relates to the work and making those two match? So you're almost a
Mhm.
communication liaison between
Yes.
those
That's
groups.
exactly that so perfect that you said it, 'cause on that government work, I would say I'm the face of the hospital to the government and the face of the government to the hospital because I
Oh,
was the
wow.
conduit.
You were at this particular pediatric healthcare environment
Mhm.
and involved in these very large grant projects. Do those organizations start to see, hey, we need to not just have a project management professional, but set up an entire PMO, an entire project
Yeah.
management office? Is that what you found in your?
So in my work working on that government grant, when the grant ended, it was sort of like, okay, what do I do now? I didn't have I was the title I had at that time was project coordinator, but I was doing project
Oh,
management work.
sure.
And then it was, well, you'd be a great fit for the PMO, which is the project management office. And
Hmm.
I was like, okay, cool, let's check that out. And when I joined the PMO, that's when I really learned about all the methodology behind being a
Mm,
project manager. And I studied, I got my certification, which was awesome. So
okay.
they wanted to transition to an enterprise PMO. So they were pretty
Mm,
well established IT focused PMO. And it was like now, people know the good things we're doing and we can apply them to other areas.
okay. So
And
for
since
the
I already had
listeners,
experience doing it, yeah.
just in case, IT being information technology. So it
Yeah.
typically refers to all the development work and architecture that's going on behind some of these
It was
projects and programs?
working on like the medical record, working on software
Mm.
upgrades, even we had to update our credit card machines. So, like swapping out
Mm.
old credit card machines for the new improved ones. Or when you go to the doctor and you have to sign your little acknowledgement that, like, you've seen your patient rights, like that little
Oh, sure.
keypad thing where you put your signature. That's part of
Mhm.
one of the projects.
Okay.
Yeah.
Okay, so that was the IT PMO side, and then they from there set up an
Mhm.
enterprise PMO?
Yeah, they wanted to transition, like grow the IT PMO into enterprise, which would include IT.
Mm.
But
Right.
it was gonna be, like, not just projects focused on software upgrades and, virtual healthcare. It was gonna be, like, public health things like, preventive care, immunizations or a pop-up food pantry. It was gonna be kind of the things that I went to grad school for, which I was really excited about.
And did you stay until that enterprise PMO was fully fleshed out, or?
Um, I think now it's probably more established than where I was, but after 3
Okay.
years, I was like, "I'm on to the next adventure,
And did
on to
that
the next
too
nonprofit."
that involved also setting up a PMO?
Yes. Working to build the project management reputation, which is what so much of PMO, like, creating the momentum of, "Hey, this is great over here. Why don't we apply it over there too?" And it's kind of like word of mouth. People get excited.
It is clunky in the beginning. Is there
Yeah.
any way to avoid the clunkiness? I mean, do you have if having done it a
Gosh.
few times, like, is it clunky because nobody just has a frame of reference yet?
So, trying to transition from, like, an IT PMO to building an enterprise because it's a new audience. Like, the IT folks, everybody's used to it, and then you try to do project management work in a different environment and people who haven't interacted with you before, and they're like, "Who are you and why are you here? And what do you want? And
Mm,
are you a threat?" Like, territorial.
mhm,
And
mhm,
what I love about project management and what I do is I come in, I do the things really well, and then I'm out. Like, I don't own it
mm,
operationally after that.
right.
And it's funny, you see a transition. Like, you first start out and it's like, "What are you doing here? We don't need you." And I call it like the Mary Poppins syndrome for me because it's like nobody wanted Mary Poppins to show up. She was too strict and she like made us clean our room. And
That's
then you have a
awesome.
great time and it's so efficient and life is great. And then she's like, "You're good. I'm out." "No, no, no, Mary Poppins, we still need you." I'm like,
You
"No,
have
you
to
don't.
stay, you can't leave. Oh
Yeah,
my
you can
gosh.
do it yourself, guys."
So, for those of you who need a more recent reference, maybe Nanny McPhee, doesn't it? It's like
Yeah,
Mary Poppins
yes.
becomes Nanny
Mhm,
McPhee, same kind of deal. But I
mhm.
I really love that analogy because
Yeah.
there's I think you used the word wary. People
Mhm.
are wary.
Yeah.
What are you doing here? What is your
Mhm.
job? What is your role? Why are you here? Are you taking my job? I mean, is that
Yes.
the attitude that you kind of felt?
Oh, for sure, because it's like, um the concept of a project lead is different from a PM. And the project lead is the subject matter expert on that project. For example, doing a pop-up food pantry, it was, you're here to help set this up, but like what happens after? And, do you s- do you do another one? And it's like, I don't know. Do we do another one? It's not up to me to make the
Mhm.
decisions. So
Right.
people just unsure of what your role is, and then when you start to work together and you create the plan and you work the plan, it's like, "Oh my gosh, I had no idea this existed. This is so great. You make my life easier." I tell my project leads all the time, "I'm here to make you look good. I'm here to like lift you up and create the scaffolding
Mm,
so that
mhm.
you look amazing to the powers that be, because I'm not there for the glory. Like you guys get the glory."
Yeah, and when you say make you look good, it means things happen on time,
Yes.
nothing
And
falls
it's
through the
efficient, there's
cracks.
no
Mhm.
rework, you're within budget. Maybe you found some ways to streamline things that you didn't before, or you identified a problem coming down the road so far in advance that you put, your mitigation plan in place and it was all fine. It's like the things that could have happened didn't happen.
So you're there to help identify these risks, to help look at, capacity, do we have enough resources? Do we need more? How do we plan
Hmm.
for that? What are the pivots that we make? And it's so fun that your cat just joined.
I
Hi,
know.
cat.
He wants to be on TV.
What's his name?
That's Colby.
Colby. That's great.
Yep.
I love it. So great. Hi, Colby. Nice to meet you. I'll
Hmm.
put his LinkedIn profile in the show notes. That's funny. Well, this is great. So we've talked about transitioning from an IT PMO to an enterprise PMO, and do you think that the way it's set up and what you would recommend are the same no matter what organization someone's in, or is it specific to nonprofit or healthcare?
I can only speak to the nonprofit experience, but I think there's similar themes in terms of initially people aren't quite sure of what you are there to do, and then once they experience it, then it makes sense. And I've had that
Hmm.
happen repeatedly throughout my career where I initially am paired with a project lead who is very skeptical, doesn't really want to
Hmm.
share information because they're worried about what I would do with it. I don't know. It was just like a lot of fear and um, kind of the theme that I run into or how I handle that is really just being a partner and how I do my work. It's like I refer to them constantly. The project lead is my is anytime I meet a new project lead, I'm like, we're going to be best friends. Get ready. And I've stayed friends with a lot of my project leads because like I'm
Oh
out
yeah.
and then they go on back to their regular job and I go on to the next project, but we stay in touch because we're invested in the success of the work, and then you build a friendship. So maybe the theme is I'm friends with everyone on my project team. I look at it as like, yay, a new group of friends to do cool things with.
I also think that it's the reason people look to you for that next decision. Like you said, they're like, are we going to do this again? But they're looking
Mhm.
to you because you've helped lead them through a successful project and have this credibility. There's this trust level now that, oh, Michelle's got it all together. She has to know what we're
Yeah,
doing next.
that's the beauty of project management.
Oh,
It's all
right.
of the feeling like you're effective and doing good work without being necessarily the one who's accountable for it. If you're doing like a RACI chart, responsible, accountable, consulted, and informed.
Yeah, you're right. So there's some glory there for those of you project managers who are not sure where all the glory lies. There it is. Okay, so let's shift because that sounds busy. A PMO,
Yeah.
you're at the crux of all this communication. You're helping teams manage
Mhm.
$1 million grants. And now you're pregnant with twins.
Yeah.
um, Maybe tell the audience a little bit, and me too, what is
Mhm.
it like in the middle of a project to find out that one, you have sort of a high risk pregnancy,
Yeah.
and two, nobody figured that into the timeline necessarily
No.
in the beginning. What did you
I
think?
was I was super fortunate that the pregnancy, like my maternity leave, landed at like just a quarterly report time. So I wrapped up one quarterly report, had the babies, was out for a while, and then returned to work just in time for the next quarterly report to the government.
That
jumping
is
right back
so
in.
project management success. I mean,
I
really, you
know.
project managers, you're all this way.
And my boss at the time, she's like bragging to other VPs in the organization, like, "Michelle came in with this plan of, like, if I have the babies early, if I have the babies on time, or if this happens, that happens," like, all these contingency plans, and I was like, "Doesn't everybody do that? No?" And I
Oh my
identified who was
gosh.
gonna cover for me, who's gonna, like, run the meetings, here are the agendas, this is how I create the agenda, and, yeah, I guess I was um, overthinking it perhaps, but it all worked out.
I think overthinking is a superpower in so many ways. Like you said, your stakeholder, she was like, "Okay, this is helpful to me. I feel,
Yeah,
like I can trust Michelle. I know she has things sorted out and organized and thereby I can
yeah.
relax." You're letting
It's
other
like
people
you're taking care of
relax.
it. Yeah,
Yes,
exactly. Like,
yes,
"Don't
yeah.
worry, here's what's gonna happen, here's what you can expect if A happens, if B
Mhm.
happens," and then, of course,
My
best
gosh.
laid plans. The plan was not to have twins. The plan was to have 1 baby.
Right.
So,
Right. A singleton, which I
yeah,
now know. That's
yes.
great.
Mhm.
So, okay, so now let's talk about unforeseen health plans because,
Yeah.
twins weren't expected, but what about the unexpected? Because, for the audience who's just listening to us, Michelle is joining us in the midst of some cancer treatment,
Mhm.
and that is an unexpected,
For sure.
happening, for you, and it's not easy to probably if A, if B, if C, when it's not something
Yeah.
that people just go through each time. So, can
Yeah.
we talk a little bit about cancer and how it
Yeah,
interrupted things for you?
absolutely.
Mm.
I think in it's so funny, in some ways, the twin pregnancy was harder than cancer, but in the opposite way, you can't plan around your cancer treatment. Like, the twin pregnancy, I could kinda plan around. Like, I knew when I would be
Mhm.
done, hopefully.
Right.
Um, with breast cancer, anybody who's experienced it tangentially or themselves, so much of it is unknown, and so much of it is the waiting game to get test results to identify what is the next step. So initially, you think, "I wanted to chart this course." Like, I got diagnosed in March, and talking to my surgeon, I was like, "Oh, by September, I'll be done." Like, she's like, "You just get a little surgery, get a little radiation, you'll be out of here by September." Okay, now it's November 15th, and
Mhm.
I'm still in treatment, wrapping things up in the next week, but it's not a course you can chart, and, when the unexpected happens, you rely on the people in your life and your resources. So,
Mhm.
I'm super fortunate where I am now. I have an amazing boss, and they are so supportive. So when life goes sideways, you lean on your resources, and you find where you are resilient. And I once heard, like, resiliency is adjusting your sails when the winds change. So
Hmm.
I really like that visual, because it's like, I thought we are on this course headed in this direction, but the winds changed and we're doing this other thing instead. And it's like, well, what do I have available to me, whether it's professional support, personal support, people take leaves of absence, like medical leaves of absence or family medical leave. Like, what are the things available to you to make your life balanced and manageable?
And can you let go then? I mean, from a project management standpoint, I've seen people are like, "Well, it needs to be like this. I need it to
Yeah.
go this way." But were you able to just say, "Hey, it's just going to go the way it goes?"
Yes, I would say I was blessed to have that experience with the twins. The fact that
Mm.
life goes in places you don't expect,
Mhm.
gave me a crash course in radical acceptance, and just, best laid plans, and then this is what happens instead. So I love that, 9 years prior to my cancer diagnosis, because my twins are 10 now, um, I learned life happens the way it's going to. So you just got to be okay with it, and do what you can with your circumstances.
And I don't have my PMP, so I haven't taken the coursework, but I wonder, is that pivoting, is that letting life just take where you go the same as what is taught there?
Yes.
Like, let's just let this project go in
Well,
some
it's
ways where it goes?
it's like, oh, the best example I have is you create a project plan, you get everybody on board, you get approvals, you have phase gates, like going from one phase to the next, like everybody's marching to the same beat. You even create risk logs and plan, like, mitigation plans for assumptions, risks, constraints, the whole thing. And then nobody planned for a global pandemic, like
Right.
projects halted. So I mean,
Hmm.
we're all privy to you put out the most beautiful plan and nothing ever happens according to exactly what that is. So you're
Hmm.
constantly pivoting with your project work. And it's like you're constantly pivoting in life too.
You are. And I just want to thank you for bringing all of those really huge super skills that you have learned, over your time in public health in the nonprofit space, but just in your life in general, this willingness to pivot, this friendliness and communication amongst people. Thank you for sharing those with all of these teams and making those kinds of projects work, where you live, but ultimately they impacted many, many people, those projects that you were a part of and executing those grant programs. So
Hmm.
thank you for that. Thank you for sharing with us about what it's like to be a project manager in the healthcare sector. And thanks for telling us a little bit what it's like to have twins and even what it's like to
Yeah.
face, difficult health situations in the midst of being a project manager too. We really appreciate you being here today.
Thank you, Trina. My pleasure.
And thanks, Colby. We appreciate you too. What a
Oh
snuggle
man,
bunny.
he's just loving it.
For our listeners, you can't, you'll have to go watch us on our YouTube channel for Wear Your Cape to Work. Colby is on the back of Michelle's chair, so you'll definitely have to stop by and see him up there. He's great. That's awesome.
Yeah, at
Well,
one point, you can't see it on camera, but he put his little paw on my back, like, "You got this."
ah, that's cute. What a support system. See, it's
There
reach
you
out
go.
to your support system. That's our final message from Colby.
Mhm.
Thanks,
He's
Michelle.
like, "Yep."
Thank you for joining us today on the Wear Your Cape to Work podcast, hosted by Project Insight. If you enjoyed today's episode, please like, follow, or leave us a comment. If you subscribe to our YouTube, Spotify, Apple, or other favorite podcast channels, you'll receive notifications of all of our new episodes. We'd also love it if you would share Wear Your Cape to Work with your network of PMPs or anyone else who might enjoy the show. Project Insight is an online project and portfolio management software that helps companies connect project data from across all of their teams and software tools so that they can make confident decisions about their business. Our website is projectinsight.com, and there you can find many resources for project professionals, including free PDU webinars, as well as a place to register for a demonstration or a consultation with one of our success teams. Thank you once again for joining today's conversation, and most importantly, thanks for wearing your cape to work.